Hello everyone. Please confirm if I am audible and visible to you. Okay. So let me introduce myself first. Myself, Dr. Shital Pipaliya. Welcome to the platform of Unacademy. You all are aware about various courses available on the platform of Unacademy. Welcome to Unacademy Future Doctors. Here, we will teach you various subjects of MBBS. We will give you conceptual, thorough knowledge of the various subjects of MBBS, which will help you to understand the subject in a better way. Okay. I am your faculty for physiology. I did MD Physiology from MP Shah Medical College. I am educating MBBS and MD students. I have teaching experience of more than 17 years and I am experienced faculty. I am one of the experienced faculty for integrated curriculum teaching. Let us go through some subscription details of Unacademy. With Plus subscription, you can have access to both. You can have access to both live as well as recorded classes. You can learn from the topmost educators of India. You can compete in live tests and quizzes. You can study on the device of your own choice. You can have access to the question bank having more than 25,000 questions in it. You can even have a printed notes with certain subscriptions. Then iconic subscription. In iconic subscription, you can have access to two platforms, that is Unacademy as well as PrepLadder. In Unacademy, there are various resources like various live batches, well-structured live batches. You can have a question bank, you can compete in live tests and quizzes and many more. And with PrepLadder, there is a facility. You will get resources like clinical and integrated essential, rapid revision, dream notes, and many more. So both are unique in its own way. Whatever is best suitable for you, that you can choose. All the subscriptions are available with various duration and different prices. You can use the promo code to get the discount. Tomorrow, I will be taking applied aspects, means ECG findings in various cardiac conditions. That is a special class available on the app that you can attend. Use the promo code Shital10 to attend the free live class. Now, how to prepare? For physiology, you can attend the live class, you can prepare the notes while attending the class. You can even get the notes with certain subscription. Notes are available, printed notes are there. Then you can even refer the books, various physiology books which are available in the market. Now let us go through physiology of cardiovascular system. Till now I covered just till now I finished, right? Now you all know about the different types of leads: unipolar lead, bipolar lead, chest leads, limb leads, how these leads are oriented with the central position of the heart, how the depolarization and repolarization waves are recorded. Everything you know now. Now I will switch to the different waves, segment and intervals of ECG. I kept hold over here, so I will little explain more about the strip first. Okay, something like this strip will be. So this is one small square. This one square is made up of 25 small square. It is 5 by 5. So it is made up of 25 small squares. When the ECG strip is running, each 1 mm x-axis represents time, right? Time in seconds. So 1 mm, each small square which is 1 mm will represent the time, that is 0.04 second. 0.04 second. Okay. On y-axis, it records voltage. So height of the wave will determine the voltage and duration will be on the x-axis, right? So on y-axis, it will show the voltage in the millivolt. 1 mm, one small square will represent 0.1 millivolt. So on x-axis time, y-axis voltage. 1 mm x-axis will represent time 0.04 second. Y-axis will show 1 mm will show 0.1 millivolt value. Now let us go through different waves of ECG first. P wave, this one, this. So P wave is due to atrial depolarization. Then QRS complex. So this QRS complex means it is made up of three parts: Q wave, R wave and S wave, together called as a QRS complex. So it will represent the ventricular depolarization. Now Q wave will show, this is important to remember, Q wave shows the depolarization of the ventricular septum from left to right. This I told you, right? That left side of the interventricular septum will depolarize first. This is very important to remember. Once the depolarization wave enters in the interventricular septum, left side of the interventricular septum will depolarize first. So Q wave recording will signifies the depolarization wave in the interventricular septum from left to right. Then R wave. R wave shows it signifies the depolarization of the majority of the ventricular muscle mass. Then S wave. S wave is for the because of the depolarization of the posterobasal part of the ventricle, left ventricle mainly. So it is complex, is made up of three waves: Q wave, R wave and S wave. Then T wave. T wave represents the ventricular repolarization, this one. Now there is a question, why there is no wave for atrial repolarization? Now try to recall the previous class, right? What I told you, that in the atrial repolarization process, the area which depolarizes first will repolarize first, right? And the ventricular depolarization process will go hand in hand. So the atrial repolarization wave recording will be obscured by the recording of the large QRS complex, which is because of the ventricular depolarization. I repeat, atrial repolarization wave recording will be obscured by the recording of the large QRS complex because of the ventricular depolarization. So whenever you record the ECG, you will see P wave, QRS complex and T wave. P wave is because of the atrial depolarization, QRS because of it signifies ventricular depolarization, T wave signifies ventricular repolarization. Atrial repolarization wave will be obscured by large QRS complex. Now see the diagram carefully. T wave is also recording positive, right? So try to recall what I just explained, that in the ventricular depolarization and repolarization process, the direction of the vector will not change. This is very important to remember. T wave is recorded positive, though it is a repolarization wave. It is a wave of repolarization, but it is recorded positive. The reason behind that is during the ventricular repolarization process also, the direction of the vector will not change. The area of the ventricle which repolarize first is the apex, right? So direction of the vector will remain same. like this. So interventricular septum will repolarize last. So direction of the vector will remain same. So T wave is also recorded positive. This is important to remember. Now come to the amplitude and duration, normal amplitude and duration of these different waves. P wave, normally amplitude is 0.1 to 0.12 millivolt and duration is not more than 0.1 second. Now you know the values of each small square. So you can correlate 0.1 millivolt, 0.1 second, how many squares it will be. Okay, duration, if I say 0.1 second in 1 mm represents 0.04 second on x-axis. So 1 second, it means how many small square it should be, right? So that you can calculate now. Then QRS complex, Q wave amplitude is 0.1 to 0.2 millivolt, R wave 1 millivolt, S wave is approximately 0.4 millivolt. Amplitude of R wave is usually high, right? Then the duration is less than 0.08 second. Now come to the T wave. Amplitude is approximately 0.3 millivolt and duration is 0.27 second. So this is about the normal amplitude and duration of the different waves, P wave, QRS complex and T wave. Now come to the clinical significance of P wave. P wave shows the atrial depolarization, right? So it shows the functional activity of the atria. P wave will disappear in atrial fibrillation. Okay. In atrial fibrillation, what will happen? There will be a twitch-like contraction of the atria. So the P wave will be disappeared. Then altered or inverted P wave in ectopic pacemaker. Goes without saying, if SA node is not a pacemaker and AV node becomes a pacemaker, then direction of the vector will change. So P wave will be altered because now the area which will depolarize first is not the SA node but something else, right? So altered or inverted P wave will be there in ectopic pacemaker. Then tall P wave in case of tricuspid stenosis, when the tricuspid valve is narrowed or stenosed. Okay, in that case the atria will contract more forcefully to push the blood in the forward direction. So tall P wave will be recorded. Then large and prolonged P wave will be recorded in case of mitral stenosis. Now come to the clinical significance of the QRS complex. QRS complex represents the ventricular depolarization. So here what will happen? Deep Q wave with other changes. This I will be explaining in the special class which I will conduct tomorrow. Myocardial infarction. Deep Q wave with other changes will be recorded. Then tall R wave. It will, because the R wave represents the depolarization process of the majority of the ventricular muscle mass. So if the ventricular muscle mass is thickened, if it is more, means ventricular hypertrophy. In that case, tall R wave will be recorded. Then low voltage QRS complex. Low voltage QRS complex will be seen in case of hypothyroidism, pericardial effusion. Here, the electrical activity in hypothyroidism, electrical activity is reduced, right? So there will be low voltage QRS complex. Then QRS complex will be prolonged in case of bundle branch block. Understand the word carefully. Bundle branch block means one side of the branch which is traveling through the interventricular septum. This is interventricular septum. This is right and left side. So when the depolarization wave is traveling, if one branch is blocked, then time taken to travel the impulse and depolarizing the entire ventricular muscle mass will be more. So QRS complex will be prolonged, right? So that is the clinical significance of QRS complex. Now come to the clinical significance of T wave. Inverted T wave, this I will explain again tomorrow in the clinical conditions related to the heart. Inverted T wave will be recorded in myocardial ischemia or infarction. Tau or peak T wave will be recorded in case of hyperkalemia. And exercise even can increase the amplitude of T wave. Now come to the different segments of ECG. PR segment is there, PR segment, ST segment, and TP segment is there, right? See this PR segment, it is the segment which is following P wave. This one. Following P wave, there is a brief isoelectric period. That is PR segment. It is approximately 0.04 second. Then ST segment. Segments are isoelectric period. So this is the isoelectric period which extends from the end of the S wave. End of the S wave to the beginning of the T wave. End of the S wave to the beginning of the T wave. Normal duration is 0.04 to 0.8 second. Then TP segment. It is a period of end of the T wave to the beginning of the P wave of the next cardiac cycle. End of the T wave to the beginning of the P wave of the next cardiac cycle. Approximately duration is 0.2 second. Now, importance of the ST segment. We consider the ST segment while reading ECG. ST segments represents, it corresponds with the ventricular repolarization. See this carefully. ST segment, this one. Okay, end of the S wave and beginning of the T wave. So this phase, isoelectric period. So it represents the ventricular, corresponds with the ventricular repolarization process. Now come to the intervals. There are PR interval, QT interval and ST interval. Let us start with the first one, PR interval. That is the interval from the beginning of the P wave to the beginning of the Q wave, and if Q wave is not there, then beginning of the R wave. This one. So this is PR interval. Normal duration is approximately 0.13 to 0.16 second. Then QT interval. It is the interval from the beginning of the Q wave. Beginning of the Q wave to the end of the T wave. Okay, beginning of the Q wave to the end of the T wave. This one. Normal duration is 0.40 to 0.43 second. Then ST interval. ST interval is the interval from the end of the S wave, to the end of the T wave. This one. Okay, this is ST interval. Normal duration is about 0.32 second. Now, what is the significance of it? The PR interval measures the conduction time, AV conduction time, including AV nodal delay. It is prolonged. If it is prolonged, it indicates that AV conduction is blocked. Say this again. PR interval is from the beginning of the P wave to the beginning of the QRS complex, right? Either Q wave or R wave. Means time which from the onset of the impulse generated from the SA node to it reaches to the ventricles and beginning of the ventricular contraction, right? Reaches to the ventricle. So it means that it will show the conduction time, atrioventricular conduction time. So if it is prolonged, it means that atrioventricular conduction block is there. Then QT interval. QT interval indicates the total systolic time of the ventricle, ventricular depolarization and ventricular repolarization. See this again. Interval from the QT interval is from the beginning of the Q wave to the end of the T wave. Beginning of the Q wave till end of the T wave. Means entire ventricular event will be understood by this, by understanding the QT interval. So it means it indicates the total systolic time of the ventricle, both ventricular depolarization and ventricular repolarization process. In case of ischemia or any ventricular conduction defect, if there is any conduction defect, okay, in that case it will take long time to travel. So in that case, prolonged QT interval will be found. Ischemia or any ventricular conduction defect which will take more time. If there is a conduction defect, in that case it will take long time for the impulse to travel through the entire ventricular muscle mass, right? So ischemia or ventricular conduction defect will cause prolonged QT interval. Then come to the importance. This is very, very, very important to remember. J point. J point. This one. This is the point of the end of the S wave. End of the S wave and beginning or start of ST segment. End of the S wave and beginning of the ST segment. So this is the point of no electrical activity. Try to recall the previous class. Once the depolarization process starts from the interventricular septum, then inner side of the ventricular muscle mass, then entire ventricular muscle mass, and last will be the base of the left ventricle. So once the entire ventricle is depolarized, ventricular depolarization process gets over. Okay, at that time there is no electrical activity because entire ventricle is depolarized. So this is the point of no electrical activity. End of the S wave and beginning of the ST segment. This ST segment will be taken as a reference when we are diagnosing the myocardial infarction. At that time, ST segment will be taken as a reference. ST segment assessment for the elevation or depression. Either this is P wave, Q wave, R and S. This is ST segment and this is T wave. So ST elevation if it goes above, or ST depression going below the basal line. ST elevation, ST segment elevation or depression is important in diagnosing the which area of the heart is infected. Depend on the which lead you are finding the ST segment elevation and depression, the myocardial infarction will be diagnosed. Now come to the vector, like how the segments or how these recording will be done. Like if I say that this much amplitude is recorded, it is recorded positive, or if it is recorded negative, or if it is not recorded at all. So how this can happen? See the diagram carefully. This is the mean vector, right? Plus 59 degree, and this is lead 1. Lead 1 is positive and is toward this side. This is negative, this is positive. And direction of the mean vector is at plus 59 degree. This one. So this is mean vector. And this is the lead which is recording, lead 1. So the projected vector is in this direction. So somewhat like this. So whatever, if you draw a line joining between these two vector, arrowhead of these two, whatever is the potential difference recorded, that way that lead will record the wave positive or negative. If it is potential difference is negative, in that case it will be recording negative. Okay, and if it is positive, then it will be recording it positive. So this way the difference, potential difference which we calculate between the mean vector and projected vector, whatever is the difference, in that way the particular lead, you have to look in the particular lead. That is why in AVR, the lead which is placed at the right arm, which is facing the cavity of the heart. Cavity of the heart, right? So that way, that is recording almost always negative. Why? So the reason behind that is AVR is in this direction and the vector is here, plus 59 degree. So normally the recordings of AVR, which is representing or recording the activity of the cavity of the heart, it is recording negative. Okay, so this is all about the physiological basic aspects of ECG, different waves, its significance, different segments, its significance, intervals, different intervals and its significance, normal amplitude and duration of these all different waves, segments and intervals. I will cover the application of it in the clinical conditions, different cardiac conditions in tomorrow class. Special class is there which I will conduct at the platform of Unacademy. You can use the promo code Shital10 and you can attend that class freely. If you have any question, you can ask. Okay, so here, with these two, ECG part 1 and part 2, I covered all the physioanatomical aspects, different leads, and basics of the different segments, waves, and intervals. Okay, so here I am finishing the ECG. Please join tomorrow's class, special class. Use the promo code Shital10 and attend that class on the app. Download the Unacademy app and attend that class free. Please like, share and subscribe our channel and help us to reach to more and more number of students. Thank you so much.